Dr. Agnes.
Hello. Thank you for the kind introduction from Dr. Nurul. Thank you very much. Um, and thank you to fellow audience for spending the time today and listening to my talk, which I was given a topic of regarding animal bites. Okay, so I have some outlines that I would like to share today regarding animal bites. I'll give a short introduction about animal bites. What are the signs and symptoms, and what are untreated animals? A bit about disease, and also what are the clinical and surgical approach towards animal bites. So this brief introduction that I got from highlight, which is given by a survey done by our Ministry of Health, Department of Veterinary Service, and Ministry of Agriculture, Food and Industry. This survey is regarding the prevention and also control of infection after dog bite. So based on the data, actually dog bites in Malaysia is the most common injury among all animal bites. And in year 2017 to year 2020, there is a total of 71,000 incidents of dog and also others animal bites cases reported. And among these 71,000 of cases, 31 reported to have rabies and 29 of them are fatal. So because of this data, the MOH actually had an alert and hence raised the awareness to the public and the healthcare regarding the importance of control and prevention of this disease, and particularly actually emphasizing on prevention of rabies. Okay, animal bites is actually a very wide topic that is given to me. So because dog bites is the most common one, so I will give mostly the example from that I gotten from dog bites. So basically in overview, clinical approach to animal bites are almost the same, except the fact that we need to know about the information of the types of the microorganism involved in the certain animals, and if there is venom present. Like for example, if there is a snake bite, we will want to know what type of snake is that, because anti-venom should be administered, things like that. So however, in dog bites, there's no venom, but dog saliva consists of a very broad diversity of bacteria. And the most common microorganism that cause infection is Pasteurella species. And this is similar to cat bites as well. And other than the microorganism involved in animal bites, we also need to know what is the anatomy of the animal that is involved. Like for example, in a dog bite, we know that dog has a, you can see from the picture here, they have very strong teeth and jaw. So we will expect that there might be a penetration to bones, joint, nerve, and vessel. Just some imagination towards that side. Yeah. So this is the example of the injury that can cause to victims. This patient is actually a patient that I got recently, 8 months old boy, and actually got attacked by own pets at home. So you can see there is a multiple injury here. There is a puncture injury. There is also degloving injury, abrasions, lacerations, yeah, and scratches, scratch marks as well. So what happened if the animal bites or dog bites are not being treated? What will happen to the patient? So it will actually lead to infection, disfiguring of injury, permanent disability, rabies, and also death. So when we talk about disfiguring injury, it happens especially if you see that the injury involve tissue loss, especially over the face. And if we talk about permanent disability, meaning sometimes there is the involvement of facial nerve injury that can cause permanent facial nerve palsy, or there is a fracture. So I would also like to give an overview of rabies. What are rabies? Okay, rabies are actually vaccine preventable, and is also a type of a viral disease which is caused by Lassa virus. And why is it fatal? Is because it's actually affect the central nervous system, and hence is highly fatal. And mortality percentage risk is near to 100%. So rabies can actually affect both domestic and also wild animals. So it actually spread to the victims um, via saliva of from the animals. If you get bitten or scratches or whatever contact with the mucosa from the animal. So, but however, this is actually preventable if the animal that attack you is vaccinated or the victim is given vaccination prior to that. So I'll give a clinical approach on how we deal with animal bites. So first of all, history taking is very important. From the history taking, we will want to know if the animal is vaccinated, is the animal pets of the victim, or is it a wild animal, and the types of animal. And besides that, we also would like to know if the victim that is being attacked is vaccinated for rabies before, and what kind of occupation that the victim work as. Because those some of the victims that got attacked, they actually work closely with the animals, and they might be vaccinated before as a prevention. And physical examination wise, we will want to know if there is any penetrating injuries, and also need to, very important to check the neurological function, and if there is any suspicious of facial fracture. So how do we know if there is suspicious of facial fracture? Is that if you see any ecchymosis from the mouth, from over the face, behind the ear, raccoon eyes, any hematoma or any deformity that you can see over the face, then is suspicious of facial fracture, then you should go for either CT scan or a simple skull X-ray. So these are the points that I actually jot down that is important during the first time when we assess the patients, like the mechanism of injury I mentioned before, this type of the animals, what is the relationship of the animal to the victim, what is the event that caused the attack, and also another thing to be aware of is the victim comorbid, because a lot of the time, if the patient is immunocompromised, for example, if the patient has got kidney problem, chronic kidney problem, the patient has got diabetes, or is a smoker, all these things will lead to risk factor of poor wound healing and higher risk of infection as compared to other patients. So how do we deal with this kind of patient if we have got patients with this kind of comorbids? Is early referral to the medical team if unable to handle them, because if it's diabetes, for example, we need to monitor the DXT, the dextrose, the sugar control should be good. And for this group of patient, is best to, I would say, best to go in early to debride because they have higher risk of infection. Okay, this good health-seeking behavior is actually effort from our Ministry of Health to initiate the awareness of rabies and by to the public. So what they actually encourage the public to do is these three immediate action if they have got a animal bite. So the first step is to wash the wound with running tap water for at least 15 minutes, and then apply with antiseptic if they have at home, and dress the wound. Then only they should go to the nearest clinic or hospital to seek for further treatment. So what do we do in a hospital or clinic setting if we see this kind of patients is to make sure that the patient is immunized, and usually we will give tetanus immunization via intramuscular route, and this is to reduce the risk of getting tetanus. And if some of the patient also they can be counseled to get vaccination for rabies as well. But however, in government, we are not practicing that at the moment. But the general immunization that we give is tetanus. How about wound management? So when we get the patient, make sure that the patient is stable to do any sort of a dressing. That is the first survey that we need to do. If the patient is well, everything is fine, tetanus is given, the immunization is given, then we will assess the wound. So for the assessment of wound, you need to open up everything, remove all the clothing, whatever things that they do. If they do a dressing there, open up everything and assess the wound. Have a look at the wound if there is any foreign body or whatsoever. If there is, then need to irrigate the wound with a lot of normal saline. So the aim of this irrigation is to remove any dried coagulation tissue if there is, and any foreign body like saliva, sand or stones or whatsoever. And it should be done under aseptic technique. So sometimes we are being, actually from my practice, I'm being taught of using a high pressure syringe irrigation. So what do I do is that I would attach a blue needle to a syringe and and irrigate the wound with the syringes. Then the water will go through the needle and it will actually produce a very high pressure. The aim of this is to actually remove whatever foreign body or saliva that is adhered to the wound. So then only you address with uh, either you can do a povidone packing or plexiglass dressing. So do we need to give antibiotic? Yes, we actually practice to give augmentin to all of our animal bites patients. And it is also proven that augmentin is the best empirical antibiotic for animal bites. So because it actually attacks the aerobes and anaerobes skin flora of the victim, and also from the mouth of the animals. And this can be used for almost all of the animal bites that we are dealing with. And if the patient is allergy to augmentin, we can prescribe clindamycin. Okay, moving on to a clinical approach. What is the indication of debridement is that if there is multiple wounds, if the wound is really dirty, that you couldn't manage it bedside, or if there is a severe animal bites, which is very bad, that you need to go under GA to really do it, to clean it up. And if you suspect of a vital structure injuries, like injury to the vessel, nerve, and muscle, that you need to repair intraoperatively. Okay, when to close the wound? This is the usual question that I'm being asked most of the time. When should we close it for animal bites? Should we close it immediately? Should we close it later? How do we deal with it? So to me, as long as the wound after debridement you think is clean, if the wound is very shallow, that you can close it primarily, sometimes I will just close it. But if the injury is too bad, then it's best to leave it open, dress first. And when do we close it later on if you do that? Is that you see if there is a sign of granulation tissue. So if there is a granulation tissue seen covering, there is no more discharge, no past discharge, then it's safe to say that yes, we can close the wound or leave it open to heal secondarily based on a case basis. So so for cosmetic reason, usually for the face, we will try to close it primarily if possible. And the choice of a suture, we will usually use non-absorbable suture. And maybe we might need a skin graft or local flap if there is a tissue loss. Okay, conclusion. Dog bites are common, and we need to treat it properly. All the animal bites can turn out fatal if not treated. Even though if it's very small, it should be irrigated or debrided and then dressed. And regular follow-up should be done until the wound is healed properly. And remember to prescribe antibiotic when during the treatment time. And also, like I say, prompt clinical approach, which is include, don't forget, tetanus immunization, wound irrigation, and dressing. All these three can actually reduce the risk of infection. And what is a good thing about surgical debridement is that it allows early wound closure. That's all from my side.
Thank you, Miss Agnes.
Thank
Regarding your your presentation just now. Okay, I would like to ask. Me myself have a
you.
few of dog bite incident, and I always have difficulty in emergency department itself.
Okay.
Because when I want to do the primary closure, because usually in my hospital we don't have plastic surgeon.
Okay.
Basically, the plastic surgeons just come for
With
from
the
HKL. They come once a month. So
mm,
basically, I have, I think, more than 5 cases
mhm.
of dog bite, and I want to do the primary closure uh, for the for the laceration wound. Okay,
Okay.
and I always get the feedback from our emergency department colleague that they said no need to do the primary closure. It will heal by itself. But for me, I think in the facial region, I need to do it. It's
Yes,
because
I
I'm,
agree with that.
yeah. But
Um,
I always have difficulty to convince them to do that. uh, so what is your
may I know?
advice for
Yeah,
me?
may I know which region first?
Face region.
Yeah, which region of the face?
Um, I
Yeah.
have multiple on the Mala area. I have through and through from face to intraorally. I've a lot of
Oh,
cases, but
oh.
yeah.
Okay, I
So,
would say if
mhm,
region like the eyelid, like the functional region, we categorize like the eyelid, you know, and then oral region, the nose. All this region is the functional region. I would say if it's possible, close it early because it will cause disfiguring later on if it's being left open up and heal secondary. Yeah.
yeah,
So the other thing to convince them is that like all this region, if it's, for example, if you want to do under ED, um, if the wound is very small, like just a scratch mark, or is just very shallow, you can do it under LA. You can make the patient very comfortable and
mhm,
you confidently debrided the edge of the wound and you can assess. It's very important for you to assess the depth of the wound actually. That is the thing that we actually didn't check properly at times. You need to check the depth because we don't know how deep. You know the teeth of the animal can, is very tajam, right? Then
yeah,
it might just grab, sometimes it will just grab on you. You don't know how deep the puncture wound is. And actually the deepest part is the place that we actually macam didn't debride. We didn't really expose
Yes.
properly. We just macam gosok dekat luar saja and go and close it up. So it will come back with infection later on.
Yeah.
So
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 usually,
if you cannot explore it under LA, I will say you better do it under GA.
yeah. So usually I will depends on the severity of the injury. If let's say it's multiple, then I will go for GA.
Ya,
But
takkan you
sometimes,
LA banyak-banyak.
yeah, yeah. But sometimes it will takes me around less than 30 minutes. I will go for LA because GA also I have difficulty to get the GA session
Oh,
in my hospital. Yeah.
then maybe you
I,
can apply a facial block lah for that. No choice then.
yeah.
Or ask the pediatric team. You can refer the pediatric team or the NS APS team for sedation.
Yes, because
Yeah.
usually in ED they give us sedation. So
Uh,
that's why I can do
then
in
can do it.
ED. Yeah.
Okay.
Okay. There is a question from the floor. Okay. Do we have to admit patient for IV antibiotics?
Depends on severity. If it's very shallow, you already close it. Let's say, let's just say like if you are confident enough to close it, I would say it's quite safe to discharge with an antibiotic. But if you discharge, please review it back regularly. Yeah, to see how is it if there is any discharge. So if you are not confident to close, usually you should admit it and start
Yeah.
IV antibiotic. If it's
Yeah.
very bad, please don't discharge.
Yes, I agree with you.
This is actually surgeon who is the one that determine should be, and usually if it's very bad, we won't do it lah.
Yeah.
Kecil
I
tak apa
agree.
lah.
Yeah, I agree with you.
Hmm.
Okay, another question. For the cat bites, does the patient needs to take anti-rabies as well?
Anti-rabies so far I'm
Ah,
not sure ED is giving that or not but I think the occupation those victim who is related to who deal with a lot of animals they should have the vaccination. But if a victim that is not vaccinated, then they will only give tetanus immunization. This is the government protocol. Mm.
Okay. Regarding the tetanus vaccination, I'm not sure. I have a patient which is less than 5.
Okay.
Yeah, less than 5. When I asked them to give the tetanus vaccination, they said no need because the patient is less than 5. Is it the protocol now after 5? Then they will give the tetanus vaccine. Is it? I'm not sure. I just asking you.
Actually, I'm not sure about that also.
Yeah, because that's why I have a lot of
I think we
cases.
have a CBG on that. We can review that.
Yeah, okay.
Mm.
Okay, another question. How long we need to admit patient for the IV antibiotic?
Okay. It's actually also depends on the wound. If the wound is getting better, and we need to see the septic parameters like the white cell count,
Mm,
CRP, all these. We will need to do it routinely, like 2 days or daily, depends on the patient condition. If they are getting better, even without the wound being closed, we sometimes will discharge and do the daily dressing first. Mm.
yeah,
Also based on case basis lah.
yeah,
So basically, you need to see clinically is the patient better and the wound condition is it getting better. And
yeah.
always, just now I didn't highlight that during the debridement, don't forget to get the culture, tissue culture, any swabs. Mm.
Okay, I agree with you. Okay, another question. Okay, can victims of animal bites who contracted rabies recovered from tetanus vaccination?
No, cannot. That is to prevent another tetanus problem. But
Yeah,
the rabies, no. Um, I think the way of prevention for this rabies is the pet need to
be
be
vaccinated.
infected.
Yeah,
Yes. And
yes.
for us, you can go and take the vaccination if you think your occupation is high risk.
Mm.
Mm. but it's not everyone should be given. Yeah.
Yeah.
Mm.
Okay. I have another question for you, Miss Agnes, because I have one episode of apa the dog bite.
Okay.
When the basically the dog is the honest dog. Okay, then we can trace lah whether the dog has the vaccinated or not. But then there is one episode whereby they ask the veterinarian to come to check on the patient and also the dog itself, because I'm not sure why, but that is being done by the pediatrician. Why? Do you have any specific reason for that? I'm not
Uh,
sure why they are doing that.
I pun tak tahu.
You put okay. Because basically that is my worst dog bite case lah, basically, because
Okay.
basically, yeah,
What did
the
the
patient.
vet doctor did?
Yeah, I don't know why they asked the vet to come to. I don't know what is they are doing,
Is
because
the
the
dog
patient,
sick? Is the dog sick?
the dog. Yes, I think the dog sick.
Mm.
Yeah, that's
So
why I think maybe that's why they ask the veterinarian to
yeah.
come and see the patient as well. I'm not sure why.
Mm. So
I
if the dog is sick, like I mean, if
mm-hmm,
the animal is sick and got very aggressive, there is
mm-hmm.
also they say it's a high risk of rabies.
Okay,
Mm.
but
Maybe they want to
but
verify something from there,
maybe like, I don't know, but
like input from them.
yeah. But
Mm.
luckily, the patient survived. I have seen the patient for 3 years now, and she recovers well.
Mm.
Yeah,
So rabies is actually preventable, but not
yeah,
curable. We need to understand that.
yeah.
So, so if you got it, it's near 100% fatal.
Okay.
So the only way is to prevent it, is to take the vaccine. Mm.
So, do you recommend I mean that everybody to take the rabies, if they have dogs at home?
Dogs at home. But
Yeah.
if your dog, usually if the dog is given vaccination, then
Mm-hmm.
you don't have to do that.
Okay.
Mm. It's either party.
Either party lah. Okay. Okay. What is the vaccination for people for at the high risk of contracting rabies? Is there is any side effect from the vaccination?
I'm not quite sure about this. It's not my expertise. But if you want to read more about the vaccination, I do found quite a detailed information about this rabies under WHO. You can read about it lah.
Okay.
Yeah.
Okay. Any other question from the floor?
Actually, my expertise is wound management. Yeah. Anyone want to ask me about the wound?
Yeah, I think
Because
we
in
should.
medical field, we have too many different fields. So my expertise is actually the wound. But because this topic given is very wide, I couldn't really go into that. It's more towards the initial management. Yeah. Like when you ask me how to close the wound and all, then okay, that is my field. Vaccination is not my field. But I do know it's important to check if the patient is taken or what. If the patient is contracted, then they should get the vaccination. Mm.
Okay, so okay, how do you actually debride the wound that been bite by the dog? Usually,
Okay,
how are the procedure that you usually done it?
okay. So the first thing is don't debright first. Open up and
Okay,
explore how deep it
okay.
goes. I will
Mm-hmm.
see which area is that. Check whether if any vital structures is involved.
Mm-hmm.
Vessel, nerve, any bone fracture and all those. Check properly first. Then next, along the way, you will see if there is any foreign body or if there is any saliva material and all this. Um, During debridement is best. Before debridement, I will usually clean it up one more round, like irrigate the wound first. Then after that, I will use a sharp blade. I will cut one layer of tissue around it.
Mm-hmm.
Okay, just one layer, like how we remove one layer of a skin. Remove one layer from inside, like do a excision biopsy,
Mm-hmm.
because we cannot see with our own eyes the
Yes.
material that is there, that
Yep.
is collected there, because you are already under the table. It's
Yep.
best for you to remove one layer of a tissue around it, like how you excise a excision
Yep.
biopsy, un until the depth, the deepest part of the wound, everything you need to remove it. I would say curate is not accurate, but I will use a blade to remove, cut, sharp cut the whole thing out. Then the skin also I will refreshen, because I don't want to leave back any kind of possible material there. I will cut
Yeah.
everything out, like cutting a tumor out like that. Then only I will close. If it's possible to close, then I close. I will only close if I think I'm very confident that, okay, this is good. This is very clean already. I'm going to close it. If I'm not sure because the wound is punctured too deep or until I couldn't assess during the first time, actually it's also okay to just dress first and daily inspect until if I see there is granulation tissue underneath, then I'm quite sure that it's good, the wound is clean. Then only I go back to OT and close it. For us, it's best to close it rather than leaving it to heal, lah, if it's possible. Mm.
Okay. What type of dressing that you use, Dr. Agnes?
Okay, dog bite, I
Mm-hmm.
mean, animal bite is best to do a regular dressing. Mm. So you can pack with a povidone packing, can, no
Mm-hmm.
problem. Usually povidone packing is good for dirty wound.
Yep.
Mm. If you think the wound you couldn't really clean it properly, it's okay. Put the povidone packing, clean it daily. Every day you pack it open, uh, and clean it. So if the wound I think is kind of like clean already, but you're still not quite sure,
Mm-hmm.
then I will put a Bactigras dressing
Okay.
and review back again daily. Mm.
Okay, from OMSSHR. Hi, doctor. What is your management for soft tissue injury with tissue loss?
Which area? We can
Okay.
always do a flat or a graph, depends on the size.
Yeah.
Mm.
This.
Anything.
Okay.
Mm.
Okay. Okay, another question. We have a case where we did DNS for the wound,
Okay.
but the wound appears not healed after STO. So what should we do actually for that case? That's the
Not
question.
heal, is there any discharge or not? Why is it not
Maybe
healed?
Wan Asmat, Dr. Wan Asmat can unmute yourself and ask Mr. Agnes. Oh, there is a
Yeah.
past discharge.
Is
There
there
is
any
a
discharge?
Yes, there is a past discharge. Or maybe you can unmute yourself,
Okay.
Dr. Asmat. You can ask Dr. Agnes personally. Dr. Wan
Okay.
Asmat.
If there is a past discharge, if it's a
Yeah,
past discharge, it's best to open up the wound
yeah.
and
Explore again.
pack the wound again. Yes. And clean it up again and don't close first, because
Yeah.
it's definitely is an infected wound. So if it's very bad, a lot of pus, admit and post under GA to explore the wound again. If it's
Yeah.
just a minimal pus discharge, sometimes we just flush the wound, pack it, and then dress daily. Then we will see back. Remember to give antibiotic, give
Yeah.
oxygen, yeah,
Yeah, I agree with you.
and get culture also. Or
Yeah, the problem sometimes the problem is if we get a lot of pus also our lab always give a no growth, no
no growth.
no pus cells in. Yes, I don't know
What
why.
kind of culture did you send? Is it
I
just swab?
Yes, I send for pass when CNS. Usually I will send pass CNS, and also pass itself. I I aspirate it and I send it also. There is no pass growth. There is no growth. So I don't
Mm.
know. I
Yeah.
always get that kind of.
Actually, cultures, right? You need to take multiple.
Okay.
Mm. For our practice, we
Mm-hmm.
take a lot.
Okay.
Tissue, swab, pass, three.
Okay.
Surely will
Okay.
come out something like that.
Okay. Maybe I need to add some more tissue
Sometimes
culture.
one is not enough. You need a few.
Yeah. Okay. Maybe I need to add some
Mm.
tissue culture after this.
Yes.
Okay. Another question. How often should we review the patient
Um, if it's during the first week of the time, maybe daily or
daily?
EOD. Mm.
Yeah.
Depends on the wound also. If it's small, you think it's okay, then every 2 days. The term that we use is regular follow-up. Every day, okay, no problem. EOD,
Okay.
okay, if it's outpatient, but it's
Mm-hmm.
in the ward, then daily lah.
Daily lah. Okay. Another question. How frequently would you retake the culture? I,
Okay, during the first time, for example, let's say you go in and take a culture and then you took some blood. Surely you will need to take some blood to show
mm-hmm.
the septic parameters.
Mm-hmm.
Okay. If the septic parameters show you something positive, like very high white cell count, and then CRP is very high, and then
Mm,
the culture came back
that's good.
something, and you're able to treat, right? You initially will start with augmentin first, right? That
Mm-hmm.
is the empirical. Then when the culture come out, they say sensitive to something else. Maybe meropenem, maybe tazocine, you don't know, cefepime, anything also can. So when you escalate your antibiotic, then you see the patient's condition. So how you see is clinically if the wound is okay or not. Okay, if the wound is improving and clinically is the patient well, you will also repeat some bloods, ma, and then you
Yeah.
see the trend. So if the white septic parameters like the white cell count CRP is coming down trend and the wound is getting better, then you don't have to repeat the culture, which means the patient is responding to the antibiotics
Dramatic,
and the
yes.
debridement that you did. So
Yeah.
it's very safely say that, okay, job is quite nicely done.
But yeah.
Okay. But however, the other way around, if you already went in clean and then escalated antibiotic and the patient is still not doing well, it's going
Mm-hmm.
to be even worse than that. I think you
Mm-hmm.
might need to investigate if there is rabies already.
Yeah. Yeah,
uh,
I agree with you. It
uh,
depends on the patient's
or
condition
something
also.
severe infection, something else. Mm.
Yeah, we should also inspect on the patient whether they have the spike fever. We have to check on the patient also.
Mm.
Okay. Okay, another question. In the facial region, what is the size that necessitates grafting?
Over the face.
Yes, in the facial region, what is the size that necessitates the grafting?
Okay, over the face, how we study face is we study it in a different region. Forehead, eyelid, nose, mouth, cheek, chin. Okay. So
Okay.
how do we assess if we can close it properly is not based on size. It's based on the skin laxity. It's based
Mm-hmm.
on the function. Like for example, the eye, if you remove quite a lot, then the eye will be contracted. It
Yeah.
will affect the function. So it's not based on size. It's based on how much of tissue loss, if the muscle is involved, and which region. How about the laxity? Because you can see if old people their skin laxity is really very
Less.
laxity is very great. Means that you
Mm.
can pull it up easily. That's how we do a facelift. But however, in a younger patient like a pediatric, few months old, like the case that I told you, their skin actually is very their dermal region is actually quite I would say quite tight. It's not easy to close it if there is a lot of tissue loss. Then at those cases, sometimes also because of the edema, during the first
Mm.
48 hours, the edema is very bad. So it's not advisable to close if you are not confident to really close it because it will book up it. So we will assess it back later. Then we will see when the swelling reduce. Then you assess back. How we assess back is that you try to oppose the skin to skin. Macam this one is the wound, right? Then you just try to oppose it. Then you see generally if the face, if there is any asymmetry and all those. I would say safe to say more than 2 cm is quite a big defect to close primarily. In forehead,
Pediatric.
okay, maybe a bit more than 2 cm would say maybe can, but you might need to do some undermining, like need a flap. Cheek is the easiest area lah. Or maybe 3 cm also you can just close primary, but more than that, you will see pulling up already, not nice, asymmetry. Eyelid is not forgiving at all. Upper lid, lower lid also not so forgiving.
Yeah.
Usually these kind of areas we will do flap and skin grafting. Nose also is not easy to close primarily, especially at the nasal tip, all this area. Yeah.
Mm. Yeah, I agree
So,
with you.
so in conclusion, the forgiving part is just the cheek and the forehead. The rest is no.
The rest is refer to nearest plastic
Uh,
surgeon.
uh,
Okay. Okay. There is another question. How does the management of the bite wound
mm.
differs from that claw scratch injuries? How does the management of bite wounds differs from that of claw scratch injuries?
Bite and scratch, is it? What
Yeah.
is the difference?
What's the different bite wound
Mm.
dengan claw scratch injuries?
Oh, okay. I think the clinical approach still the same. You still need to give the injection, the immunization. Everything, wound irrigation still the same. Just that need to assess or if it's a scratch wound, I will want to see how deep it is. Is it just the epidermal region of the skin or already reached the dermal region? If it's reached the dermal region, sometimes also I will just close it with a suture. Yeah. If if you can see the fat is exposing already lagi lah, better close it lah, because we don't want any very bad scar forming over the face lah. So if it's just the epidermal scratch, then you can just let it heal lor.
Uh, Okay. Any other question from the floor? Okay. I think there is no more question.
Okay.
I would like to thank you, Miss Agnes, for your informative lectures just now and willingness to answer all my questions and from the rest of us.
Okay.
Okay. From MABD, we would like to thank you for your time and information. Okay.
Okay. Thank you.
Okay.